Hello, welcome to Aging Well in America. I'm Gattari, your host. Every day, up to 10,000 people in the United States turn 65 years old. There are 5.5 million people today aged 85 and older. By the year 2050, that number grows to 20. 20 million people will be aged 85 or older. Are we ready? Is America ready? There's so much good work going on around the country, around the community, and right here in our own backyard. And we have with us today somebody who is working on some of those issues. With us is Dr. Mckee from the Metropolitan Eye Center. Welcome, Dr. Mckee. Thank you for joining us today.
Thanks for having me, Anne-Marie. It's very nice to be here.
I'm really excited to talk about the issue of vision health. It's something we haven't really explored, and I think that it's almost, I don't know, I don't want to say takes a back seat, but when our elderly parents and grandparents think about their health and their well-being, and even those of us who care for them, the adult children, I think that the vision issues are often secondary because they're not the crisis issues. However, I'm sure you can tell us why that shouldn't be. Talk to us just a little bit about what are some of the main diseases that the elderly face?
Sure. In terms of eye disease, probably the big eye disease that everybody has heard about and everybody knows about is cataract. It's one of those things that is a very gradual onset, and you don't really realize that you're even suffering from the disease until you start running into trouble with everyday tasks in terms of vision, reading, watching TV, seeing those street signs.
What is a cataract?
A cataract is clouding of the lens inside the eye.
Okay.
There's a clear kind of M&M-shaped lens inside your eye, right behind the pupil, that from a very, very early age does a good job of focusing light right on the back of the eye, so you can see a very nice, clear image. Over time, impurities and things like that start to build up in the lens, and it starts to get a cloudiness or a brownish hue or some other changes that make it not focus the light quite
Now,
as well.
does that happen naturally as we age? Does everybody get some degree of a cataract?
That's exactly true, yeah. To some degree, everybody will have some cataract. I'll see, healthy young people, 40, 50 years old. When you look under the microscope with the regular examination, you can start to see some cataract. It doesn't usually start to contribute to vision loss until much later, and there are other things that can contribute to making it worse.
Is there anything, okay, so there are things that will contribute to making it worse, so conversely, you can do something to prevent it from getting worse?
To some degree. So the things that can make it get worse are, a history of an injury to the eye. So being safe, preventing yourself from having major injuries to the degree you can, wear safety glasses, don't be a boxer, things like that can help prevent cataracts. In addition, just making sure your general health is good can help prevent certain types of cataracts. Things like diabetes can contribute to the development of cataract, use of steroid medications. So by being a healthy person, you can help at least delay the onset of a significant life-affecting cataract.
Yeah. And if you do have a cataract that is somewhat advanced, the treatment is surgery?
Correct.
Okay.
Yes. At this point, we haven't found a way to get the cataract out of the eye without surgery, but over the course of the past several decades, and even more so over the past several years, the cataract has become, or the surgery, I'm sorry, has become quite advanced and fairly easy to live through in terms of surgeries.
Okay. Outpatient?
Outpatient surgery. Yes.
How long does it take?
The surgery itself takes in the neighborhood of anywhere from 10 to 20 minutes, depending on the cataract itself in the hands of the surgeon.
Okay. And that's something you do right at Metropolitan Eye Center?
Correct. Metropolitan Eye Center has associated ambulatory surgery center on site. So all the patients who see us there are able to have surgery there as well.
Okay. How many cataract surgeries do you do in a week or a month? Is it fairly common?
It is fairly common. It's actually, in terms of surgery, it's the most common surgical procedure done this year overall.
Okay.
any ophthalmologist has kind of a variable number. I myself probably do in the neighborhood of 20 per month.
Okay.
But
that's considerable.
Indeed.
Yeah, yeah, okay. And the other diseases that we hear about when we're thinking of our grandparents and parents?
Sure. They're more specific eye diseases, as well as a contribution of whole body systemic disease. So macular degeneration is something that a lot of people have heard of.
What exactly is that?
Macular degeneration is a disease that specifically affects the central part of the vision. In terms of medical explanation for it, basically it's the buildup of byproducts of your eye working in a spot where they shouldn't be building up. And over time, those byproducts that build up can start to injure some of the tissue nearby.
I see.
And affect its ability to properly work.
So my understanding is that you see peripheral vision, but you don't have a good
correct. That's exactly the case.
Forward.
Yeah, and unfortunately, you know, the vast majority of what we need to operate is right in front of us.
Right,
so,
right. So somebody with macular degeneration lives with it how?
There are definitely strategies that they can use. By magnifying things, you're making the part of the world that you need to see take up a larger portion of the vision.
Okay.
So if you only can't see this very central part, make your letters take up all of this part.
Right.
Use your peripheral vision to read and things like that.
Okay.
That helps. Certainly making sure lighting is good, making sure that your household is laid out in an ergonomic way. Things are where you know they should be. There aren't tables that you're going to trip over when you don't see them.
Right.
That can help you live with it.
Okay. Help me with convince some of my clients. One of the easiest things to do and most important is to remove the rugs, right?
Oh, absolutely.
Remove those small rugs.
Yeah, it doesn't take much for you to get a little ripple in a rug.
Yeah.
And if you have, you know, any kind of significant eye disease, you won't see that.
Yeah.
And that can be, you know, the cause of a fall and the start of real medical problems.
Falls can really complicate vision issues, can they not?
Absolutely, and vision issues even more so can complicate falls and lead to other medical issues down the road.
That's right.
Yeah.
That's right. And the third one that we were talking about before the show started.
Basically, general medical health.
Okay.
Diabetes, high blood pressure, things like that can absolutely contribute to eye health. And by not staying on top of and being careful with the treatment of those diseases, over time you can compromise your ability to see well.
Sure.
Without even realizing that it's
sure.
a cause.
So if you are diabetic, if you have heart disease, it is important to take the medication that's prescribed for that.
Absolutely.
Have your primary care physician treat those, and stay true to your treatment, to your regimen.
Correct. And even that all said, it's important that an eye doctor sees you regularly as well, especially with diabetes. The changes that diabetes can cause to the back of the eye initially are not things that contribute to change in vision. It's things that, in order to be detected, someone actually needs to look inside your eye and see if you're having these problems.
Interesting, interesting. So, for a typical medical physical exam, we go annually. For a typical well-being vision exam, how often?
For someone who's not having problems with their vision, who doesn't have diabetes, doesn't have high blood pressure, has not been told that they have a family history of macular degeneration or glaucoma or other eye diseases, probably every year or two is safe.
Okay.
Once you start getting into those issues where you know you have diabetes and you're at risk for eye disease, someone has told you that you have a family history of major eye problems, then no longer than every year.
Sure.
If an eye doctor sees you and sees the start of problems, they may ask you to be seen even more frequently than that. But usually every year is safe for at-risk people.
Okay. What are some of the symptoms that people should pay attention to when their eyes, that is signaling that there's a change in their vision health, if you will? sometimes I get those floaty things, and
absolutely.
I'm always thinking, well, it's a stress. I need to drink more water, so I do that, and that's probably some of it. But I don't know. Is that a signal that something else is going on?
It is actually something you should pay attention to. Really any subtle change in your visual function, what you're seeing, the comfort of your eyes should all be paid attention to. Specifically the floaters, you mentioned the eye is filled with a clear gel called the vitreous. When you're a teenager, it's a nice, solid, clear ball of gel that just lets light go right through it. As time goes by, the protein scaffolding, so to speak, that makes up the gel can start to clump together. It liquefies, it sloshes around in the eye. All of that can contribute to little clumps that cast a shadow on the eye, and there you see the floaters. As it liquefies, though, the eye movements allow it to slosh, and that sloshing around can cause the gel to tug on the inside of the eye. If it tugs hard enough, it can actually tug a hole into the eye, which can present a real problem down the road. Retinal detachment, serious problems. So even a new cloud of floaters that you didn't have before, especially if it's accompanied by flashes of light, absolutely needs to be seen by an eye doctor. The type of problem that can cause, the earlier it's detected, by far you can decrease your chances of losing vision from it.
What's a treatment for something like that?
Let's say, for instance, that a retinal tear or break has been detected. A specialized eye doctor, a retinal specialist ophthalmologist, would treat with either a laser or a freezing probe to try to, I guess, essentially scar around the tear to prevent further problems from happening.
If that's what it is.
If that's what it
it's
is.
a tear. Okay.
Right.
Okay. Yeah. And other symptoms that an elderly person might notice in changing eyes.
Probably the most thing is changing eyesight, as you were leading to there. It's too easy to dismiss. Well,
like when you're reading, all of a sudden,
exactly.
It's a little more blurry than.
Yeah, and the trickiest part is that it's not usually all of a sudden. It's kind of a gradual decrease. Things you used to be able to read, you really struggle a little bit. Maybe if I just blink my eyes, things like that. If it's not easy to read or watch TV as it used to be, as soon as you realize you're having trouble, it's worthwhile to be seen, because we may be able to do something to make it easier.
Yeah. And just some of the things we should be doing all the time anyway when we're reading. Good eye lighting.
Good lighting is useful. You can take some strain off your eyes by using the correct strength of reading glasses or bifocals. That's all helpful in terms of strain. In general, you won't hurt your eyes by not doing these things, but it can help with comfort.
Sure.
Not hurting your eyes is key. So if you are, doing anything strenuous where there's a risk of the eye getting bumped or injured, wearing appropriate eye protection, with use of tools and things like that. Eye
preventing things from flying in, right?
Exactly.
When you're riding a bicycle or a
leaf blowing or any of these things that we don't really think of as being that dangerous. There is too much of a possibility of accidental injury, which can be devastating.
So really wearing some type of eye protection, whether it's sunglasses or like you said, safety glasses,
yes.
When you're doing anything that things are swirling around or could come.
Very good idea.
Yeah. Okay. One of the things I wanted to ask you is, what's your feeling about the eyeglasses, the reading glasses, the cheaters, as we call them, that we can pick up at any local pharmacy? This
may come as a surprise. I think they're great.
Good.
For the vast majority of people who don't wear glasses, for distance vision, cheaters is all you need.
Yeah.
For people who have a corrective prescription, the cheaters don't provide as optimal of a vision experience, but for people who have never worn glasses throughout their life and suddenly start realizing they're having some trouble with near vision, cheaters is probably all they need.
Yeah. It truly is a magnifying glass.
That's exactly the way it behaves, yes.
Yeah. Well, tell us a little bit about the Metropolitan Eye Center itself. It's in St. Clair Shores on Mack Avenue.
Exactly.
Across from St. Joan of Arc Church.
That's the place. It's been there for nearly 30 years.
Okay.
We have 5 ophthalmologists who are surgical eye doctors having completed medical school, and 1 optometrist who mainly specializes in our refractive glasses and contact lenses.
Okay.
And it's a fairly comprehensive center. We have optical studio, and as we had talked about, the surgery center. We have a full suite of diagnostic instruments. So it's very, very rare that if you were being seen at Metropolitan Eye that we need to send you anywhere else for any testing or anything like that. I'm very happy to be there. I'm proud of the center and proud to be a part of it.
Now, you're a fairly new doctor, and you've been practicing ophthalmology for, including residency, for about 5 years?
That's correct.
Yeah,
Yep.
yeah.
And
so, how did you come to this area of medicine? I'm sure a lot of people, as you were going through medical school, had a lot of ideas for you, right?
Sure, absolutely. There are a lot of choices the way you can conduct a medical career. I actually had a fairly good idea I was going to do ophthalmology before I even entered medical school.
Is that right?
My father is not an ophthalmologist, but he has supplied a lot of the instruments for ophthalmologists in the area here, including Metropolitan Eye Center.
Oh, okay. All right.
I was well acquainted with Metropolitan Eye Center even before I started medical school through my father.
I see.
Just kind of having all the instruments around, which admittedly are pretty interesting instruments and cutting-edge stuff.
Like what? What are some of these instruments? What are we?
Probably my favorite one. It's called the OCT. It stands for Optical Coherence Tomography. It uses a very specialized light that it shines in your eye, and it can essentially create a 3D tissue-deep picture of the inside of the eye.
Wow.
Almost like taking a piece of the tissue and looking at it under a microscope, but using light to do it without having to take it out of your eye, obviously.
Yeah.
It's amazing that we can do that. We can also, create 3D color pictures of the inside of the eye that we can display on the computer screen and show people during their eye exam. So we can point out exactly what we see in terms of disease or normal findings.
Right, right.
It's all very, very cool technology.
It sounds like it, and I can see the excitement in you. You really, you're really happy working with this.
Yes.
Yeah, yeah. So, was there anything about? Was it the instrumentation and the technology that drew you to this part of medicine, or was there?
Sure. That obviously made me aware of it and made me think of it as a possibility. Going through medical school, you start to see some of the other specialties. There's tons of technology in things like radiology and neurosurgery and things like that as well. With ophthalmology, I feel that I had an opportunity to, make a significant difference in a lot of people's lives in terms of cataract surgery. It's, during my training, during medical school, seeing the ophthalmologists have patients come in the next day after surgery and give their doctor a hug because they could see such brilliant color and things like that that they hadn't seen before.
Yeah.
It's pretty rewarding.
Yeah, so it is. It's a shame that we tend to accept the limitations as they happen, right?
Absolutely.
Whether they're in vision or mobility or, even cognitive issues, we tend to accept them when maybe we don't have to. Maybe there is a reasonable and a workable fix.
It's a matter about finding out what can be done.
Absolutely, absolutely. I also wanted to ask you to just kind of take us through, as for a little younger population, people in their 40s and 50s as they age, and as I mentioned earlier, all the people turning 60 every day. What are some of the things that they really shouldn't, we talked about, accepting these limitations, that they really shouldn't accept and really should look at more seriously and either, go have an eye exam if you haven't for a
Exactly.
while.
So in terms of that younger population, probably the first thing that they're going to start notice noticing with their vision and with their eyes that seemed to serve them fine before is that near vision. The arms will get a little bit too short. You'll need to have very good lighting and things like that. And using the cheaters, as I had mentioned before, is great. But there are other options in terms of non-glasses correction for near vision as well. Contact lenses have come very far, especially for people who have refractive error and would otherwise need to wear glasses. That is an option. Some people use monovision contact lenses, one in the right eye for distance, one in the left eye for near, and a lot of people do very, very well with that. The technology has improved for bifocal glasses as well. Most people don't wear the line in their bifocal anymore. And that is, the idea of that line is a turnoff for a lot of people, which causes them to resist going and seeing an eye doctor for their near vision. There's also some stuff that's on the horizon surgically, not approved yet, but when it does, we intend to have it that can help with near vision as well. And
oh, really?
Obviously, I can't say too much about it because it hasn't
we
come
won't
out
press,
yet,
but we're curious.
and we're very excited about it as well when it comes out.
And the use of technology that is so much part of our days, the small screens on the phones, the laptops, the iPads, screens are really getting smaller. Staring at that day in, day out, hours and hours at a time. What's the impact of that?
In terms of vision in the eye itself, not too much. Strain is the biggest thing. Another thing that I've been running into a lot over the past couple of years is dry eye. When people sit at a computer for 8, 10, 12 hours a day staring at what's on the screen, they aren't blinking as much as they should. Oftentimes they're in a institutional office environment with commercial air handling, which is a lot drier than home or natural air. And the symptoms, the things that people run into from this dryness can be pretty vague and hard to pin down. It can just be a little bit of blurriness every once in a while that you really have to blink to clear up. It can be a discomfort, an ache. You can actually feel dryness. It can feel like something's in the eye. Or it can get a lot more disabling than that, pervasive poor vision, an ache around the eyes that you can't clear up by blinking, things like that. So oftentimes getting started with just a moisturizing eye drop can be really, really helpful for that, for people who wouldn't have thought of doing that.
Just put it in your eye every so often.
Exactly.
Just when you think about it.
When you sit down at the computer and then every few hours.
I'm thinking not a bad thing to get up every once in a while too, several times throughout the day, walk around, go outside.
Exactly. That is essential. It is.
Yeah, it really is. And of course hydration, right?
Sure.
Drinking more water than coffee, etc. I'm thinking also is not a bad thing.
Exactly. And a lot of these things you're mentioning, the getting up in the water, it's more so than just for your eyes. It's for your body.
Yeah, it really is.
It's a stress around your neck and shoulders.
Absolutely. And it's also connected. One thing we haven't touched on, we have a few minutes left, and I would like to, is migraine headaches and vision. What can you tell us about that? What is it, and is there, again, what's the treatment?
Classic migraine is the one that we think of that has the aura that you have before it. Basically, what a lot of people will describe it as is a shimmering shape in their vision that essentially moves around with their vision. Classically, it lasts about 20 minutes, but it can last longer or shorter. People can also have other phenomena in their vision related to migraine. Some people have described, losing half their vision or distortions in the vision and things like that. A lot of times it's things that sound very weird to people who are not experiencing them. It's possible to have that aura and then not get a headache afterwards and still have it be related to this black box of migraine disease.
Okay.
It's determining whether something is migraine or not is more than just that sounds like a migraine. That's the way it starts out, but it's important to have a comprehensive eye exam as well as seeing a medical doctor to make sure there aren't other known causes or discoverable causes for the vision problems or the headache. Whenever someone has a change in headaches, if they weren't having headaches before, and they start developing headaches, or if they had headaches every 6 months and now you're getting them every couple of weeks, it is essential to be seen by a medical doctor as well. There are scary and dangerous things that can cause headaches if they're not discovered. So.
Yeah, migraines, when it's almost like if you're somebody who's unfortunate to have them, it becomes like I've got a migraine now, I'm debilitated for a day.
Right.
But like you said, it could be the symptom, right, of something else that's
exactly.
going on. Yeah. Well, we've got about a minute left. What have we missed that, or what would you like to emphasize in terms of eye vision health?
I think we've been pretty comprehensive here. I think I'd like to reemphasize the importance of getting regular eye care, even if it's every 2 years.
Yeah.
Don't ignore those little changes, that little bit of difficulty that you're having with the TV. It's worth checking to see if there's something that's causing it and what we can do to help with the troubles you're having.
And again, going to an ophthalmologist who is a medical doctor as opposed to an optometrist who really looks at the prescription that is the result of.
Yes, and for many people, that's all that's needed. But when you start getting to the point where you can have medical disease of the eye, glaucoma, macular degeneration, in some cases an ophthalmologist can provide services that aren't available to an optometrist.
Okay. So if you've got any of these symptoms, you really need to see an MD.
Sure.
Yeah.
Flashes, floaters, decrease in vision, eye pain, redness, crusting. If it doesn't seem right, don't ignore it.
Okay, very good. Thank you so much. What a really interesting and important topic that we're covering. And again, taking care of your overall health is important because it can contribute to issues with your vision. And we just really don't want people to have to live with limitations if they don't have to, right?
Exactly.
Yeah. Okay.
Thanks for having me
Thank
on.
you for coming, Dr. Mckee.
My pleasure.
Once again, I thank you for joining us for another episode of Aging Well in America. Please do send us your ideas and your requests for interviews and other topics you would like to have covered here on our show. Thank you so much, and we'll see you next time.